Hi loves, welcome back to my YouTube channel. My name is Tamara. If it is your first time here, you're welcome. If you're an old subscriber, thank you for coming back. Thank you for supporting me. Thank you for everything. If you're a new subscriber, welcome to the Tammy family. I hope you stick around and help me and we'll go together. Most questions, like what they normally ask when you first enter, who are you, or tell me about yourself. So basically this is yourself, but you are not going to write it, you are going to verbalize it, you are going to say it. So I advise that you practice it at home because you're not used to saying it, you're used to writing it. So you practice, oh, my name is so and so, I'm so and so of age, I have 5 siblings, blah blah blah, the school you attended. So you'll be writing it like can, and they'll say stop. If they say stop, don't be sad that they said stop. That means they've heard what they wanted to hear. And the next one is why are you here? What is your mission here? Like, what do you want here? So you just say in a simple term that, oh, you are here for the nursing interview, you are here to be interviewed for you to achieve your dream of becoming a nurse, and blah blah blah. And sometimes they ask you, why do you want to be a nurse? So you have to tell them why you want to be a nurse. If there was a story why, what made you decide to be a nurse, that's what they want. So Abia, when my mommy was sick, I went to the hospital, how the nurses treated my mom, I really liked it, I have a passion for it, so I'm here to achieve my dream of becoming a nurse. Make it short, simple, don't go and elongate anything there. And another question is, who is a nurse? So they're asking for the definition for a nurse. So Abia, a nurse is somebody who takes care of people, both the sick and the healthy, because you have other type of nursing. So yes. And what is nursing? So the definition. So sometimes they normally ask, what are some of the qualities of a good nurse, or the qualities of a nurse? A nurse must be confident, a nurse must be observant, a nurse must be trustworthy, must be sympathetic, must be empathetic, must be what again? If you've watched my other videos, I mentioned a lot in it, so I advise that you go and watch it. The qualities of a nurse. I think if you Google it, it's going to give you a lot. And if I remember any, I'm going to link it in. I'm going to leave it on the screen. So the next question they normally ask is the functions or roles or importance of a nurse. So what role does the nurse do? They take care of patients, they help maintain the patient's personal hygiene, they give medications, all that good stuff. So please take notes of the question and please practice on it. These are questions that are asked. I guarantee you that even if you are not asked any, you ask like 5. So I beg you, please go and learn on it. The next one is mention some departments or units in the hospital. So these are the units. We have the maternity units, we have the OPD, we have the X-ray units, we have the emergencies, the units we have in the hospital. So labor ward, all that. Please Google it, you'll find a lot more. So another question is, what motivated you to choose this profession among the numerous ones? So basically your reason for choosing nursing, like I said, what are some of the negative comments you've heard about nursing? So maybe if you've heard that nurses are rude, nurses are very impatient with patients, nurses are that they shout on patients, like bad behaviors of nurses you've seen, and what is your view on it. So maybe you've witnessed something that a nurse was being rude to a patient. What was your take on it? How would you have done it differently, and what advice would you give to nurses? Maybe they should be more patient with patients and all that. That's what the question entails. So they can also ask you that, which of the qualities do you possess? So maybe if you are observant, you are trustworthy, the nursing qualities you said before, which of them do you possess? You are respectful, you are punctual, you are empathetic, like the things you said. So it's basically the same question, but they framed it in another way. So another question they ask a lot is, what program did you offer in your SHS, and the various subjects, that is electives. So you mentioned, if you did general arts, you mentioned, oh, I did government, I did CRS, I did literature, I did history, like every course you did in school, your elective and your this one, and they'll ask you to relate it to the nursing. So if you did CRS, how would you relate to nursing? Maybe the spiritual aspect, when a patient comes and the patient has lost faith, the patient is down, you use some Bible, whatever, to encourage the patient. If you did languages, how would you relate to nursing? You can say that because a lot Ghanaians, we have a lot of languages. If somebody comes and the person is only understand Twi, you'll be able to communicate in Twi. If you understand Ewe, you'll be able to communicate in Ewe. If the person understands French, you'll be able to communicate. So that kind of relation is what they want. And current affairs, I'm begging you people, this thing you have to chew it, Baba. It's already Baba, because they ask it a lot. It's a cliche, like it's a cliche, like every time they ask. So please learn current affairs, the ministers, especially the health minister, the president, the vice president, the school you are going to, the original, like the school, the region you are going to, or where the school is, the region, the original minister, their deputies, the education minister, where you live, your minister. So if you live in the Antoman, maybe Ablekuma West, Oslo Usu, like you have to know all these things. And the director of nursing service in Ghana, and yes, basically that is it. So another question, the last question I'm going to enlighten you about is, why did you choose the particular school you are going for the interview? Like, why did you choose it? So maybe you chose it because they have a reputation of producing excellent nurses, or you like how disciplined the institution is, and all that good stuff. So basically these are a few questions you are normally asked for your nursing interviews. And when you are done with your interview, if they ask you to bring the pen and pencils they ask you, just to drop it in whatever they want you to drop it in. You thank them and you leave with confidence. Even if you think you didn't do as well as you wanted, you leave with confidence. So yes, I think I'm going to end today's video here, but if it's long, I'm going to divide it into 2 parts so that I won't bore you people with a whole lot of things. But it is my prayer that any of you who is going to watch my videos, you are going to come back with testimonies in my comment section saying that, oh, all that you've learned, that's what came. I'm begging you people should read right. The ministers, it's very important. Please learn the ministers. If you don't know how to get them, please Google, you will get. I'm begging you. I ask that everybody pass their interview, and by September, October, our comment section will be flooded with like, yeah, I've gotten an admission. That will make me so fulfilled. So I didn't get what I'm doing to you guys. Like, I didn't get somebody to help me through it. I didn't get somebody to advise me. So I went to various interviews to enlighten myself. But I'm grateful to God that I'm able to do this for you. I wish you the best of luck, and please, when the questions that you learned here drops, please come back to my comment section and post it there for other people to know that there are really questions that are asked. So thank you for thank you for watching this video till the end, and thank you for listening to me talk for all this time and not forwarding the videos. Thank you so much. Don't forget to like, comment, subscribe, and yes, thank you so much. See you in the next video. Bye. Thank you. So please, these are the questions we discussed. I'll ask that you screenshot it and go through it. I wish you all the best of luck.